It is getting down to the wire this election season, and your vote could determine what kind of care you receive the next time you go to the hospital. 10 candidates are running for 6 open positions on Lee Health's board of directors. Thanks for joining us. For Fox 4 News at 6, I'm Jane Monreal. Patrick Nolan has the night off. Our Rachel Lloyd joins us live now from Cape Coral Hospital, sharing what the candidates plan to do if elected. Rachel?
Candidates focused on 2 major factors they saw play out early on in the pandemic: capacity at hospitals and the budget. They say if they're elected, they'll take their approach a step further. All eyes have been on the healthcare system this year. The pandemic filled hospitals with COVID-19 patients, forcing Lee Health to bring in more nurses and postpone elective surgeries. Elective services resumed in May, but board member Sandy Cohen, who's running for re-election for District 3, says that contributed to Lee Health's $20 million deficit.
This year, instead of how much money there'll be to buy things, it's what can we do without, because we don't have any money to buy.
I talked to candidate Kathy Bridge-Lyles, who worked at Golisano Hospital and is the current chief administrative officer at Lee Health. She says she's aware of the complicated decision regarding elective surgeries, but if it means helping the budget, she would vote to continue them in a surge of COVID-19.
When we look at all the stars and they're aligning correctly and there'd be no negative impact, then yes, I would.
A few years ago, Cohen, along with other board members, voted to double the bed capacity at Gulf Coast Hospital, adding more than 300 beds, which he says came just in time for the pandemic.
We've turned out to have made a good investment, because without those beds, we'd have people hanging from the chandeliers.
Candidate David Klein says the healthcare system needs even more beds and potentially more hospitals.
I think it starts with understanding what's needed. What's going to be delivered inpatient versus outpatient, and what does that imply in terms of beds and operating rooms. And then once you know that number, you can begin to look at the best placement for them.
Klein and Cohen both agreed that areas like North Fort Myers, Cape Coral, and Lehigh Acres need that capacity the most, but they say they have to come up with a clear plan before they decide where to expand first. Live in Cape Coral, Rachel Lloyd, Fox 4.